Well, good evening, everyone, and good morning to those who are in the US. My name is Sudeep. I'm Healthark's co-founder, and this today is now at this point is the last session of this three-day conference, and recognize that we do stand between with respect to weekends. But I promise that it'll be a fascinating session, very interesting because it's also a very critical topic that we are here to discuss, right? So the focus is on the role of digital health in driving patient centricity. Uh, and what we'll do is that we'll talk about how digital health technologies are reshaping patient experiences and driving a more patient centric approach in healthcare. We'll also discuss and explore various facets, including the integration of digital tools to enhance patient engagement, impact of telehealth, and also look at what drives and what are the challenges with things like remote consultations, continuous monitoring, and so on and so forth. It's my honor to introduce to you the moderator for this session, Pratyush Sharma. Pratyush is a healthcare IT leader. He has over 18 years of experience in providing consulting and advisory support to leading healthcare organizations across the entire value chain. He's a global healthcare consultant and has a lot of exposure working across multiple geographies and multiple clients across India, US, and the Middle East. He is currently the lead of the Digital Health India efforts at the World Economic Forum. So, Pratyush, welcome to the conference, and I'll just hand over to you.
Thank you, Sully. Thank you so much. And let's get started. So, good evening, everyone, and good morning for the audience from US. And thank you so much for joining us today for what promises to be an insightful and forward-thinking discussion on the role of digital health in driving patient centricity. I'm Pratyush, lead digital health India at the World Economic Forum, and I have the privilege of moderating this esteemed panel. So, why is this topic important in today's context? As we navigate the rapidly evolving landscape of healthcare, digital health is emerging as a transformative force. Its potential to enhance patient care, drive innovation, and reshape how we interact with patients is profound. In an era where patients demand more personalized, accessible, and efficient care, digital health solutions offer unprecedented opportunities to meet these needs. However, challenges remain, and today's roundtable discussion aims to explore these opportunities and hurdles. We have gathered a distinguished panel of senior leaders from the industry, each bringing a wealth of knowledge and experience to this conversation. Let me briefly introduce them. We have Mr. Gaurav Kantyagi. Gaurav has more than 25 years of experience and currently serves as partner and director and global practice lead for biopharma and digital health at Nagaro. As a technology leader, his focus is to provide consulting services, drive lean innovation, and digital transformation initiatives for his clients. Next, we have Ms. Gorika Chako. Gorika is Vice President and Global Life Sciences Industry Leader at Wipro. She is a proven industry leader with more than 20 years of experience in management consulting in healthcare. Gorika specializes in connecting with clients and partners to find innovative solutions to complex business problems. Next, we have Mr. Manoj Balaji. Manoj is CEO of TatvaCare, a healthcare technology company catalyzing the transformation of care practices through digitization. Manoj has more than 19 years of experience and extensive experience in business leadership and strategy across the healthcare and technology sectors. Last but not the least, we have Ms. Silvana Sinha. Silvana is the founder, investor, and CEO of Prava Health, Bangladesh's first and only one-stop shop click and brick outpatient healthcare system, established with the mission of democratizing high-quality medical treatment in emerging and growth markets. Today, Prava Health serves more than 700,000 patients, bringing international standards and many quality healthcare first to Bangladesh. A warm welcome to all the panelists. Now, how we have structured the session is like we'll start with the promise of digital health. We'll go into the practice, like the real life examples. We'll cover the pitfalls, which are the challenges, and we'll then conclude with the path forward for the digital health. So let's begin with the promise. Gorika, I would like to begin with you. Given your experience at the intersection of technology and healthcare in Wipro, can you share how are global trends in digital health reshaping patient-centric practices? What advancements have you seen that are moving healthcare toward being more patient-centered?
Um, thank you again for this opportunity, and so happy to be here. as a part of this panel on such an important topic of patient centricity. So, I have two major words to use in where we're trending now, which is great for patients, which is personalization and precision. And what is really driving this trend at a supersonic speed is the power of AI, because you can now give the right kind of curated experience to the right patient. So it's not a one size fits all, based on digesting reams of data that a human mind can't, but AI can. And you can do that depending on the use case, also get predictive. So see signals on behaviors and nudge patients even before adverse event occurs, as an example. So there's really across the value chain, when you look at engaging with patients through adherence, clinical trials, or wellness, there is a huge benefit of AI being leveraged for personalization and precision.
Thank you. Thank you, Gorika. Next, I will invite Gaurav. As a practice leader for biopharma and digital health, you have a unique vantage point in observing the digital transformation efforts of various healthcare organizations. So, what are you observing? What are important trends for your clients? Cannot hear you. Yeah, Gaurav, we cannot hear you. Is it with me or others can also
No,
respond?
I
No,
might want to
yeah.
move to the next panelist, and then once he's signal is better, we can come back.
Okay, let him rejoin. While Gaurav joins, maybe I can invite Silvana or Manoj to talk about some of the trends that you are observing.
Sure, I'm happy to go next. Thank you again for having me. This is a exciting group of people that I'm sure we can all learn a lot from each other. I think that what we're most excited about at Brava Health is actually the opportunity to combine technology with in-clinic and physical healthcare services. And we like to call this click and brick healthcare. Because I really think that we need to be very careful when we think about digital health. It can't solve all the problems of healthcare, certainly in our countries where we don't have the level of infrastructure we need to provide basic healthcare solutions for our populations. And so what technology gives us the opportunity to do, as Garika mentioned, is really to leapfrog, right? And to accelerate, increase access, improve quality of diagnosis, improve quality of the operations as well. And so we really like to think about it in those terms, in terms of how do we build click and brick healthcare systems that can help to improve outcomes and access for our populations.
Thank you, Silvana. And Gaurav, will you speak? Uh, you're on mute. Yeah, we can hear you now. So let me invite you to talk about the global trends.
Can you hear me now? I'm sorry.
Yes, yes,
Oh,
yes, we can hear
finally.
you. Go ahead.
I'm so
Yeah,
sorry.
better late than never.
Super. Anyway, okay, so I'll just circle back on the question that you have asked, probably in terms of in the transformation side, how these trends are. I'll give you an example and how generally Nagaro is doing. We are bringing the tech into the implementation and the solutions, solving the real world problems. So when we are building the solutions, we always have a patient, the customer centricity in mind. And when it comes to digital and life sciences industry or digital health solutions, we keep the patient centricity in mind. Now, in the execution of the digital transformation programs, whenever we are working with the federal or state health authorities or agencies, we look at their objectives, their goals, the current state versus the desired state, looking at the kind of buy-in we are able to secure from the business and sponsors. We generally work in terms of engaging by keeping certain considerations in mind for the transformation side. So one is you look at the current ecosystem and work in identifying what will work for the futuristic need and what doesn't. So you justifying why you retire the existing systems that doesn't or fail to meet those objectives in the past. Then you refurbish some of the existing systems, and then you start building the new set of systems while defining the wrappers and integration. We all know and understand the legacy that we also inherit while devising the new set of systems. Another aspect that kicks in is about the existing processes, and then you start redefining the new set of processes and also creating the ones along with the services that you offer to the patients, keeping the patient centricity in mind, the unified platforms that you can offer to the staff and doctors. Now, all of this comes keeping the criteria in mind. In the digital health area, when you are building such solutions, you have to keep the experience in mind, which means the higher user approval rate. When you are building a solution, you also need to validate in terms of how you are able to improve the patient outcomes. The insights that you are building for the HCPs and the kind of data you are offering in the hands of the patient. And same time, when you are building, you have to keep what kind of turnaround time you are able to offer the services that you are building for the patients that you have. And subsequently, and the effort that we have seen in most of the transformation projects is the digital literacy in mind that stays at the center. If you are able to create a better literacy in terms of the use of those services and features, you have a higher success. And having said that, the aspects of what we have seen and the demand coming from the customers, that while building such solutions, can you make a shift towards this shallow medicine to the deep medicine concept? And then when you're building such solutions, it's all about bringing that level of empathy where doctors who are working on such solutions are not losing their time in terms of capturing all kind of data sets which are accurate in nature, rather investing more times in order to ensure a pass on the empathy, which means you need to address the feeling of being heard. So this deep medicine comes when you are building the deep phenotyping as part of the solutions that you are building. Subsequently, the deep learning that comes into play, which enables the HCPs in order to make the decision making, and then bringing the deep empathy as the overall play. That's what I would like to comment.
Thank you so much, Gaurav. And I think some interesting points around digital literacy, empathy. I think these are, critical aspects to take care of. So let's move to the next section, having explored the potential of digital health. So we should now look at the real life examples and implementations. And I think examining some concrete examples can provide valuable insights. So without further delay, let me invite Silvana. I think how has digital health helped you connect more effectively with your patients? Can you share how it has contributed to better care outcomes for you?
Sure. So I think I'll first maybe just share a little context on what Prava Health does. So Prava is a vertically integrated outpatient healthcare system, a one-stop shop for outpatient care, including primary care, secondary care, labs, imaging, and pharmacy. And all of our services are available both in clinic as well as remote and virtually. And so our we brought Bangladesh's first patient app, which we launched in 2018. And we have served, as you mentioned, more than 700,000 patients with both in-clinic as well as virtual and remote care. So initially, the app was really focused on medical records and appointment bookings, which for our market is very novel. Just as is true across South Asia, but to Western audiences might be very unfamiliar, most Bangladeshis are carrying their medical records around in bags. And so they literally show up at Brava's clinic with a suitcase of their medical records. And so we will scan and store their records there for them to promote a continuity of care for the provider, but also to improve access for the patient to their own records. But then when the pandemic hit, we preponed the launch of other digital products, such as telemedicine and e-pharmacy and remote care management. And this really allowed us to serve a broader segment of society. It allowed us to serve patients who weren't even just only based in Dhaka, the capital, which is where we are headquartered, but we were serving patients from all over the country. And so the connectivity really did help to increase access. In terms of the outcomes, we actually built a tool during the pandemic that was called Pranno that allowed for remote management of COVID. And this was really based on self-reporting of biometrics. And I'll just echo, Gaurav's point, which is as we think about the tools that we're building for our populations, I love the use of the word empathy. I think it's absolutely critical. Another way to put it is human-centered design, right? We have to build tools that are really going to meet the needs of the end users. And so an app that you have to download isn't going to serve a lot of people in Bangladesh who operate on feature phones. Feature phones only have 2-3 apps on them, right? And so we built a tool that could operate on top of Facebook Messenger using AI and machine learning. And so basically, Facebook Messenger is very commonly used as a communication tool in Bangladesh, even more common than WhatsApp. And so through that tool, we were able to communicate with patients. They were self-reporting their biometrics that were then getting escalated to medical professionals for review, which would then determine whether they needed to just message the patient, they needed to call them or have a video consultation with them, or if they needed to tell them to go to the ER. But through this remote care management tool, we were able to reduce hospitalization rates from 51% to 17%. So we were able to slice them into a third of what they were at the national level.
That's great example, and really appreciate. I think the real life examples is something which adds a great value. So I'll invite Manoj. In your experience of leveraging technology at TatvaCare, can you share a real life example where digital health has significantly improved patient care and engagement? What
Sure,
digital strategies work for you?
sure. No, first of all, thanks for having me here, and it's a pleasure to be with the entire panel. So, first of all, I echo pretty much a bunch of sentiments or comments which is made by other panels as well. I think what we've been doing at TatvaCare is sort of a combination of multiple things. So, what we're trying to create is, just to give a context as well, that the entire patient care continuum, it starts from a healthcare provider side as well. So we actually have, both the sides stitched together from the platform where healthcare providers, be it practitioners, be it clinics, or be it hospitals. So we are very well deeply integrated with them from accessibility for the patient. So the first piece of the puzzle to solve is, and increasingly in the last 5-6 years, especially as a group as well, we've grown significantly from a perspective that the access for various healthcare needs for individuals, that's sort of taken care of, be it consultations, be it diagnostics, be it delivery of medicines, and so on and so forth. What now we've been able to do, especially on, I'll talk about on the whole healthcare practitioner side as well, we've kept them at the center of the universe as well. While patients are obviously free to choose and anyone, but very often than not in India especially, people still go to their primary care physician or at the hospital and so on and so forth. What we have been able to do is, can we, and we're stitching together that journey, and we're fairly done significant success in that part of it as well, that if they have whatever prescriptions a doctor would have consulted with and given, one is about fulfillment, but can we create care pathways for them post facto, especially if one, fulfilling the needs of what have been prescribed, but secondly, if suppose they have been advised for any care management, be it from either chronic care or especially from lifestyle related management, so that they are able to see outcomes for the patient in terms of health improvement, can that be reported back to the healthcare practitioner or their primary care physician, for example, or a specialist for that matter? We've stitched that entire journey together on the platform itself. Today, from a patient care perspective, we've actually tracked data in 3 or 4 key parameters or categories. One is clinical parameters of individuals. Secondly, the entire integration with respect to be it wearables, be it AI-led tracking, or a lifestyle-related adherence of the individuals. All of that is stitched on the platform. Today, in their medical records, not just digitization of the records, that's sort of now table stakes. We're able to actually analyze and show in a digitized format to the patient as well as to their treating physician in terms of how the trends have been, how the patient progress has been, and so that they can actually take a more informed decision. We're also keeping in mind that while the virtual and virtual care facilities are available, we're also sort of enabling that with how do we stitch the physical care aspect with in clinic patient care as well. So we're trying to marry the whole aspect so that both patient and doctor, the connection is sort of maintained throughout, and patient can actually get a more better health outcome, especially for the entire care pathways across various conditions, be it metabolic conditions, be it fatty liver, diabetes, hypertension. Our programs have resulted in significant reduction in their respective illness quotient, if I may say, for different therapy areas. As obviously different parameters, be it diabetes, it's HbA1c reduction; for fatty liver, in terms of how their liver function test performs and their overall metabolic condition. So we've been able to see more specific healthcare outcomes over a period of time.
That's a great example. I think there's a lot to learn from the real life examples, and I would have loved to invite Gaurav and Gaurika also, but I'm conscious of time. So let's kind of move to the next section. We have heard some excellent examples which have highlighted the potential of digital health. So, but they often accompany the challenges or the pitfalls. So common issues could be like privacy and security concerns, interoperability problems, high implementation costs, and resistance to change. So let's hear from our panelists, like what are the critical challenges that they have encountered and how they have actually, implemented different strategies to overcome some of these challenges. So Silvana, I'll come back to you. While there is, lot of discussion about the potential of digital health, implementing these solutions in the real world comes with significant challenges, especially in the low and middle income countries, right? So what has been your experience? Could you share what obstacles you faced and how did you overcome them?
So I think it's very interesting. The trust gap is so large in Bangladesh, and I think across South Asia, where patients really don't trust their healthcare system. And so they often don't prefer a digital first option. Even I'll just talk about marketing, right? So we are very active in terms of our digital marketing. I'm sure my colleagues here are also in our part of the world. We can't get around it. But what we see is patients in Bangladesh, and I'd be curious to hear what it's like in India. They will engage with the ad, but then they won't click on it to book. They will call. They will call because they want to talk. They want to learn about who the practitioner is they're going to be engaging with, and learn more about Prava and our services. And so I think the human touch element absolutely has to be built in to the way we design our digital tools. And so, even in terms of the use of telemedicine, we saw huge upticks during the pandemic. Now it's down to a more normalized level. Patients still prefer to be seen if they can, in most cases. And so I think that's very important for us to acknowledge and recognize. A lot of it does relate to literacy. And I think as the trust grows between the provider and the patient, they do become more comfortable accessing telemedicine. But I think that trust factor has got to be there. And it's something we have to keep in mind with respect to all of the tools that we are using. Even in terms of the data that patients provide to us, right? They're many times nervous about providing too much data. Even in terms of estimating the socioeconomic status of our patients, it's very difficult to do so because we cannot ask them sensitive questions like how much, what is your income? Where exactly do you live? Things like that. And so I think all of those things create significant challenges, even to understanding our patient populations.
Yeah, so these are the real life challenges, and I would request all the innovators and the tech enthusiasts to take care of the human angle. These are the real problems that you need to consider while you're developing the real solutions. Now I'll request Manoj, like what are some of the key barriers in implementing technologies that enhance patient centricity? Could you share like how healthcare organizations can effectively prepare for and overcome these challenges?
Yeah, so I think I sort of agree with what Silvana mentioned as well. I think while the human touch element is important, and she asked the question, how is it in India? I think in terms of people sort of availing services through the various health tech platforms and apps, I think it has seen an increasing trend. To be very honest, having said that, there is a significant. I mean, in terms of penetration, there's still, considering we have a large population, I think there's still a significant, offline-led process which still continues to work. But I think it has seen a significantly increasing trend for sure, right? Having said that, look, historically, and COVID has changed a lot of things for many industries, and healthcare has also seen some impetus post COVID as well. But one of the biggest issues which we continue to have in terms of barriers of implementation is that today, health tech platforms today predominantly have different combination of services, be it one, they aggregate various providers, or for example, there are very few who actually provide digital care per se, but still the physical care is an important part of it. But I think considering the legacy systems which is still used by healthcare practitioners or hospitals for that matter, or their usage of technology to manage patient care. Today, a burden of healthcare in Indian healthcare ecosystem and perhaps elsewhere as well is still significantly high, right? But their use of technology to manage patient care is still at a very, very nascent stage. And it's still work in progress. I think there is, from the whole impetus which government is driving towards through Ayushman Bharat Digital Mission, where eventually there is going to be significant interoperability of data play, which can come into play. And, like how it has happened in India, especially the fintech play, where, the whole UPI moment which happened, the moment it happens in healthcare, what would happen is that people would be bound to sort of use that in a regular way, especially the digital health platforms. And that also requires a lot more impetus, or, on how, or rather, it is going to be imperative that the policies and the regulation and standards need to be set. Today, the regulation is fairly vague about a bunch of services around digital health services. So I think that needs further tightening from various aspects of it, and data privacy and data confidentiality is a big part of it. So I think these changes is in play as we speak. But having said that, it's still a long way to go, and working with the entire ecosystem where there is still fragmented integration which is available, that poses a big challenge in terms of adoption and adherence. As much as that technology is available, it's just that people have to continuously use that. Yeah.
Excellent points, Manoj, and I completely agree with you. When it happens, it will happen very fast. So we have to be ready with the technology adoption, right? So now let's move to the next section. I think we covered trends. We, listened to some great real life use cases, and we also understood some of the challenges. Let us now talk about the path forward. So at World Economic Forum, we strongly believe that no single entity can improve the state of the world on its own, especially when it comes to healthcare, collaborations, multi-stakeholder connects, and dialogues such as this one. Public-private cooperation, these are all things which are required. Let us see what our industry leaders have to say. Gaurav, I'll, request you. I'm keen to hear your reflections on the path forward. Over to you.
Sure. Thanks. Unfortunately, I could not comment on what Silvana said in the context of Bangladesh versus the adoption. I mean, I just would like to still make a comment and leave the impression around that. Based on the research that we continuously do in the context of our customers, I would like to just say that telemedicine is here to stay post-pandemic. The results and research shows, and I proudly say that we were also behind TatvaCare, but same time we have done a lot of digital health platform generations, right, during the COVID time. One of the extensive one, which probably giving and offering 65 therapeutic areas, including 18,000 plus doctors, and it's one of the largest chain of hospitals in India. What we have validated, looking at the analytics, that 3 out of 4 are still telemedicine conversations that are happening. The adoptions
Wow.
are very high, and especially Indonesia and Australia. Just to give the facts and figures, China, exclusively Vietnam, from 0 to significant jump, and likewise Singapore and likewise Hong Kong has gone significantly high, while India, you have seen a marginal dip from 59% to 55%. So it's there and staying back. All I'm saying is we are just focusing from digital centric generic solutions to more disease centric, and subsequently the way forward appears more on a patient centric solution, so that you bring more gamification play, you bring certain techniques and tactics which allows patient to stay with you. And this is how the whole movement of digital solutions happen. Everywhere we see people are bringing new trends of the gamification theory of octalysis. What it means is it's a right mix at the right stage at the right tonality to make sure that the patient feels secure, stays motivated, rewarded, grounded, that the kind of reality that they're going through is getting them with no false sense of comfort. So that is one thing I would like to make a comment out of it. Now, the multi-stakeholder play that is coming into is, as I said, from a generic tech people deciding the kind of tech solutions that we are building, your multi-stakeholder collaboration is coming into play, where you are trying to make, again, keeping an empathy in mind, every stakeholder into play, whether the doctors, the clinicians, the nurses, the patients or staff that is coming and having a burden, what kind of solutions that you are building that can help them to ease off their burdens. So AI, definitely, I don't doubt. We even tried, I throw you an example of metaverse, where the ask from a customer, and there's always an urgent desire to bring new techs into play. But metaverse is not a kind of a solution which really worked so well in a very new, young age population countries. I don't want to name it specifically, but they are very up in trying new techs. And it didn't work so well when it comes to telemedicine, trying it out. But it works very well in terms of the adoption for the set of use cases where you would like to pilot in terms of the trainings, in terms of educating the patients that what kind of procedures you're going to go through. Giving an example of a dentist, where in a metaverse scenario where you work on a telemedicine like patient and doctor engagement, same time there is a picturization and visualization of the kind of procedure you may go through, easing off the sense that probably this is a nice way of comforting a patient, and the patient is up for to undergoing for such procedures. So it's a very wise selection of the kind of tech you would like to choose, whether it is an adoption of AI. And even in the provider space, whenever the provider comes to us and would like to understand how would you enable us more on an AI track, we have to bring the operational elements, the practitioner elements, and the disease elements in terms of putting in high impact and low impact versus high investments versus low investments in order to enable their decision making, what to adopt for the futuristic solutions. That's how I will say you need to be a guiding force for your customers in order to tell them what is a wise selection of the tech, not driven by the urgent desire coming from the requirements as part of their vision.
Great.
Excellent points, Gaurav. Gaurika, I'll come to you now. Like, I would like to hear a similar reflection as a, as a technology leader. What are your thoughts?
Sure. So I think everybody's spoken about the tools and technologies. I mean, so Wipro also has a platform called the Collaborative Care Platform, where we've got a lens of a sponsor, a lens of a healthcare practitioner, a lens of a patient, and a lens of a payer, right? And that's really taking all the stakeholders into the mix. And just like what everybody has said, the same features exist within our technology as well. I think what we all have to be very conscious about is when we talk about it's about the patient and it's patient at the center, as a technologist, you get very, very excited about the next best thing. And as a patient, you only use this technology when you're sick and you want to get well. It's not like going to Netflix and watching a show, right? Or going on Facebook and seeing what your friends are doing. And I think that context is really important, because if you lose that context, the use cases that you sometimes go after become more like the shiny object as opposed to true impact. And sometimes true impact, and I'll give you some examples of that if we have time, but sometimes true impact is very simple. It's just connecting a few dots. For example, a patient that cannot afford medication on an ongoing basis, connecting them when the physician is prescribing the drug, if they know that fact, connecting them to the sponsor for financial assistance. Because most sponsors, which are pharma and medtech companies, provide financial assistance on their drugs and devices. Half the time, the patients aren't aware. And the healthcare practitioners aren't aware that the patients can afford it. And then you can see the how downstream impact, right? Because if you're not adhering to your medication, you fall off, your health gets worse, it's more cost to the healthcare system, and the loop becomes worse. So again, that's a very easy connect. Does not require anything flashy, and I think it's really important for us to keep that in mind. This is not Netflix.
Excellent points. I think, solve for the real need rather than running behind the flashy stuff, right? So that's the summary of that. So I think, thank you so much for an excellent discussion. But as a lightning round question to close the panel before we open to Q&A, in less than 30 seconds, please, because we are short on time. If you had to leave one concrete call to action for global leaders to advance digital health and enhance patient centricity, what would it be? So I'll start with Silvana.
Oh gosh, can you repeat the question, please?
Yeah. So I want you to, if you were to leave one concrete call to action for global leaders to advance digital health and patient centricity, right? So what would it be?
I would go back to my original point, which is that there's a limit to what technology can achieve in terms of increasing outcomes and access without investments, parallel investments in basic infrastructure. Healthcare in Asia is underfunded every year at the level of $60 billion, and that's infrastructure. That's not counting the digital investments that are required. So it's very exciting to talk about digital health, and I'm passionate about it, but we cannot forget the need to invest in basic infrastructure, because without that, we'll never be able to have the impact and outcomes we aspire to achieve.
Great. Manoj?
I think, and I sort of, like I mentioned earlier, technology is there. Technology, everyone has technology. I think in Indian ecosystem especially, the stakeholders need to come together and adopt it in a more regular manner. For that, I think the best way which is possible, in my opinion, I think there needs to be a clear policy directive in the whole, from a regulatory side of it, and some sort of a mandate for digital adoption needs, which is already in play as we speak, like I mentioned earlier. But I think that need to become, more. More practically executable as we go forward. That's the only way things will shape up for technology to start giving more results for the entire stakeholder ecosystem and to the patients, of course.
Okay. Gaurika?
I can get off mute. I would say call to action would be to have a more concerted focus on women's health, because again, the data is historical, and that data is based on trials, and most trials have men in those studies, and therefore the medications that come on the market are based on and the trainings on healthcare practitioners is based on that. So we need more concerted effort on women's health across the journey of their from childhood all the way till old age. And that would be my call to action, and an ecosystem around that.
Thank you. Gaurav?
Yeah, awesome.
Sure. So my call to action will be, as we have talked about different tech, it's all about the convergence of this tech all the unmet needs in maybe the newer ways. Relook at the design biases that are out there. So you have to look at the physical transformation to fully digital, and then if you talk about fully digital, you have to encourage and incentivize to digitize the whole ecosystem without offering additional burden on healthcare.
Great. Thank you so much. Now I think we can open up to audience for a few questions to the panel. I would like to invite the Healthark team to, kind of state the questions, please.
I'm so sorry. I do have to jump off. I have a hard stop. Pratyush, I really apologize that I can't stay. Even I just have to jump on to another session actually where I'm speaking. So
No, no,
I apologize.
absolutely, no problem at all. So
Thank you for understanding and wonderful to meet all of you. And I guess I dodged all the hard questions you guys are going to ask. Bye.
yeah. So I think we have a question on screen. Given the diverse patient demographics and conditions, what are the key criteria for determining which types of digital health interventions are most effective in improving patient adherence to treatment protocols in chronic disease management? So I would probably request Manoj to answer this one.
Yeah. No, thanks for that's a great question. I think, a great question with no straight answer. But the only aspect which I'd like to sort of comment upon is, in the entire, the patient adherence aspect, there are multiple facets, like we spoke about a little while earlier as well. We firmly believe that while the digital health adoption by patient is sort of sporadic and it continuously is improving, but having said which, the human touch element which someone spoke about earlier in the play, I think more from an assisted patient care is extremely important to drive the patient in the right direction in terms of what works for them, because there's no one size which fits all. And it also, I think Silvana mentioned about the fact that in Bangladesh, especially, people have feature phones, but in India, at least, the smartphone penetration is much better, and people are very accustomed to using apps. I think it's still much easier for people to adopt for various adherence protocols, but they still need to be guided, which is the digital literacy part which we spoke about. So I think a combination of how assisted care can help the patients use the digital adoption in terms of how them sort of keying in their progress data will help them for better outcomes, and also for their care provider, be it a physician or a specialist, can actually guide them better. I think that's an important piece. So I would say the criteria is not one size fits all. It's sort of a more assisted care which needs to be clubbed with technology for patient to have better outcomes. I hope.
Do we have time for me to add something to it? Yeah. So I think, this is where the social determinants of health and the data that you collect from that becomes so important. So although India does have more access to digital phones, etc., you will see when you collect data that a lot of households have one phone for the entire household. And guess what happens when the man goes to work? He takes the phone with him. And so if the woman's at home and needs to see a doctor or have her child see a doctor, there's no access. So what do they have to do? They have to relate. They have to, work with, the term is Anganwadi workers, who go into a lot of these slums and work with them. And that is the level of detail that we need to get to truly have impact. Because then when you're looking at Anganwadi workers, you have to look at, well, if you're going into a slum, do you actually have internet connectivity? You have broadband access. Does that work with the apps that you've built? How are you going to get them information in a language that they will understand? Because a lot of people coming into the slums don't speak the language of, say, if they're coming to Mumbai, they don't speak Marathi because they're coming from other parts of India, right? So there's just so many nuances that one has to keep in mind to that question on patient demographics if you truly want to make impact.
Can we have the next question up?
Quite a few questions, but I'm also getting pings from the organizing team, Pratyush, that we are out of time.
If you are talking, we are on mute.
Can you hear me?
We can hear him. We can hear him.
We can hear you.
Okay.
Yeah. I was just saying that the organizing team is sort of nudging me to wind up, unfortunately, because we have the valedictory up next, and I think both the speakers are waiting in the waiting room, which is a shame, to be honest, because we have at least 2 or 3 more questions which we could have covered, but fortunately I think we've run out of time. Pratyush,
You're on
No, I could not
mute.
hear Sudeep, so if I'm not sure.
Oh, he was just saying we need to wrap up because the final
Okay.
session is waiting for them.
Okay, so
we need to wrap it up.
yeah. Okay, so maybe one last question, and then we go into conclusion. Is that fine, Sudeep?
I think we'll be a 5 minutes over, Pratyush, so we
Again,
should.
I can't hear him.
So he's saying already someone
This is
the
wrap.
He said
they're
this.
waiting, so we have to
Okay,
wrap
okay,
up.
okay.
Yeah,
All right.
sure.
So we'll quickly wrap up. So I think it was a great session. Today's roundtable on the role of digital health in driving patient centricity, explored the trends, the promise, the pitfalls, and the path forward. We opened with Gorika and Gaurav on the real promise of the global trends. We looked at some real life examples, and I think they like especially from the LMIC setting. The people, the innovators have to focus on what is the real need rather than going behind the fancy stuff. We also looked at various challenges in digital health and the ways to overcome some of these challenges. And finally, our panelists, talked about the path forward. And I think the need of the hour is like the multi-stakeholder collaboration, ensuring that we focus on the right needs, ensuring that we focus, we hear the patient, what the patient really wants. That's what we have to, focus on. Uh, Finally, we concluded with the call to action where the panelists talk about you know focusing on the basic infrastructure, regularizing some of the things, focus on the women health, and also looking at technology, bridging the gap between technology and the real healthcare needs. So I would like to extend my deepest thanks to esteemed panelists Gaurav, Gaurika, Manoj, and Silvana for their insightful contributions to today's discussion. A special thank you to C4IR for powering this roundtable discussion on such an important topic. I would also like to thank Healthark Insights for arranging this virtual summit. And I think this is the need of our more dialogues are required to talk about future of digital health. And finally, thank you so much to the engaged audience for your wonderful participation and thoughtful questions. I look forward to continuing these important conversations as we collectively work towards patient-centered technology-enabled healthcare solutions. Thank you so much. Thank you, everyone.
Thank
Thank
you.
you. Thank you, everyone.